Manager, why don't you open that up?
Appreciate that. Thank you, Mayor and Mayor Pro Tem and council members. As was stated, the purpose today is really to provide an overview of the two emergencies that we're experiencing, the pandemic and then the winter weather events, and then to take immediate action to continue to provide resources and support for our community as we not just get through this event, but then start the recovery process. We were not able to provide the COVID update last week for obvious reasons, but we did want to make sure that we spent time today giving you and our community the most information that we have at this time. So with that, I'll turn it over to Dr. Pickett.
Good morning. Thank you, City Manager Cronk, and also Mayor Pro Tem, and City Council members. I'm filling in for Dr. Escott this week, who is out training with Texas Department of Public Safety. And just in case anybody forgot about COVID, I can tell you COVID did not forget about us. So if it's possible for AV to share my slides, that would be fantastic. Thank you. Next slide, please. So for our update today, we have 237 new cases, 304 confirmed current inpatients, including 38 in our alternate care site. We have 102 confirmed ICU inpatients, of which 71 are on ventilators. Over the past 24 hours, we've had 35 confirmed COVID-19 admissions to the hospital and 50 confirmed discharges. Next slide, please. This is our update for today. Now, I want you to view with caution the data towards the right side of that epi curve there, and I'm going to get into that a bit, but unfortunately the weather disaster did affect reporting and the data that stream that we received here at Austin Public Health. Next slide, please. So this is our COVID-19, our confirmed new cases. Now you will note that there is a gap, a 1 week gap during the ice storm there. This is for a few reasons. One is that the testing sites, due to the inclement weather, were closed, as well as the interruption in the data stream from some hospitals due to computer outages, which affected that. Also, as the hospitals were in disaster mode, reporting is still catching up there. Next slide, please. So here we have our new admissions to the hospital, and you will notice that the 7-day moving average, that yellow line, stops about a week ago, and I'll get into why we have stopped calculating that for the moment. Next slide, please. And here we have our current hospitalizations, ICU admissions, and ventilator use. Again, the dashed lines, which are our 7-day moving averages, we stopped calculating those temporarily. But as you can see, we're generally on a good trend as far as our hospitalizations are concerned. We're leveled off a little bit in terms of ICU admissions and ventilator usage, but still at least trending down somewhat. May I have the next slide, please? So we're not calculating the 7-day moving average again until February 27th. So we had this sustained severe weather event for a week. The data collection site was without power and without water, and our folks could not get in there in any event to work on that. The hospitals, as they were operating in disaster mode, they did have a computer outage that interrupted data reporting. And there is also changes in clinician behavior which we can't account for, which, as the hospitals were dealing with extraordinary volumes of patients, then we don't know how that may have affected individual clinicians' decisions to test or not test specific patients. There also was changes, obviously, in patient behavior. Patients who may have delayed presenting to hospitals because of this severe weather event. We had a substantial shift in the overall patient types that we were seeing. So we had very few motor vehicle crashes. We had quite a few falls. And then we had our dialysis patients. As the dialysis centers were offline and our patients went without dialysis for a period of time, more of them experienced shortness of breath. Whether or not that meant that was more or less likely to result in testing, we don't know. So The 7-day average is what drives our changes in our risk-based guidelines. This is what helps us to understand, to level out the peaks and valleys from day to day and understand the general trend of where we are going with this virus in the community. Because we have such a radically different week last week, we felt that it wouldn't be right to try to calculate that 7-day moving average based on incomplete data, missing data, to make decisions that would potentially affect people's behavior and potentially affect their safety. Because of these changes in patient behavior, because of these changes in testing and this interruption in testing, what the data that we get from that 1 week period may not accurately reflect what the disease is actually doing within our community. And our feeling is that bad data is worse than no data. So we have halted calculating that 7-day average until February 27th, when we'll have a good solid week of good data, and we can resume calculating it at that point. The question that I've been asked is, what effect will this winter storm have on transmission within our community? And we don't know. The ice storm did provide a lockdown of sorts, and it did broadly limit people's movement throughout the community. However, there were a lot of folks who had to shelter in close confines with family or friends to flee houses that were without power, without heat, without water. And so how that will affect the spread of the virus within the community, we won't know that for another week or two as more testing comes in. May I have the next slide, please? Our regional infusion center, which opened on the 6th, has to date served 658 patients. We have plenty of capacity. We have 90 appointments per day. We have a regional call center where any clinician can refer patients to the infusion center. And our capacity is such that we're getting all next day or even same day appointments for patients who are referred to this infusion center to receive monoclonal antibody therapy, the Regeneron product and the Eli Lilly product. This is an infusion that helps to prevent hospitalization, potentially prevent the more serious forms of the disease. May I have the next slide, please? Our alternate care site continues to operate at the convention center. We have 37 patients at the ACS. We have 154 patients who have been treated and discharged from that facility. Our capacity currently sits at 75 patients, and our average length of stay is 9 days. I know there's a discrepancy between my first slide and this slide in terms of the number of patients. This one is the more up-to-date number as of just a few minutes ago when I got the update. I have the next slide. The alternate care site there, just a picture of where the patients are coming from. This is definitely a regional resource. You can see all the different counties which have contributed patients to this alternate care site. And then from looking at the Austin metropolitan statistical area, 92% do come from within the Austin MSA. However, 8% do not. Next slide. So this is the hospitalizations by age group, and overall we're seeing this sort of wavering up and down. No really large trends to report other than this little blip on the age 20 to 29 age group, as that age group seems to have picked up with hospitalizations. Next slide. This is the overall count by age group, and as you can see, the 20 to 29 age group represents a larger percentage than it has previously, but overall not a lot of movement in the number of cases there. Next slide. So here we are looking at our data by race and ethnicity, and the one thing I want to call your attention to is this uptick in Black non-Hispanic patients that are hospitalized. So we saw this increase. That's that gray line that you see. However, as I'll show you on the next slide here, that doesn't necessarily show an increased number of African-American patients who have presented, but they are representing a larger overall percentage compared to hospitalizations. But as you can see, there was only a difference of one patient from the previous week to the last week. This is a little bit too early to tell if this represents a trend or not, but simply this week's data shows that African-American patients a little bit increased representation there, but overall decrease in case numbers makes that an exaggerated effect. Next slide, please. This is our long-term care facility weekly dashboard. You can see this online on our Austin Public Health website. I have no great trends to talk about at this point. Next slide. Here, the Influenza Report, and we are still in the midst of flu season. However, I'm happy to report that this is a very, very mild flu season. Next slide, please. As you can see, the blue line is the current flu season, and then the other three lines represent previous flu seasons. And I think that this shows that many of the measures that we've taken with social distancing and masking and hygiene have helped to decrease the spread of influenza within our community. As influenza is a disease that kills 20 to 80,000 Americans every year, this is indeed good news in the otherwise grim news of this pandemic that we've had. Next slide, please. So we remain at stage 4. This is, we recommend for high-risk individuals that they avoid gatherings greater than 2 and that they avoid dining and shopping except as essential. And for everyone else that we avoid social gatherings and gatherings greater than 10 and avoid non-essential travel. We still recommend that businesses remain at 20 to 50% occupancy. Next slide, please. Thank you. So stay home if you can. Of course, to do essential trips such as seeking medical care, obtaining groceries, etc. Those are important to continue. However, outside the household should continue to mask, should continue 6-foot social distancing. And schools should limit attendance at sporting events to the players, the coaches, and the parents. As we do not see big spreads within classrooms, we do see them associated with athletics. So next slide, please. That is all that I have. I would like to open it up to Director Hayden, please.
Good morning. Thank you, Dr. Pickett, for joining us today. We want to start by just kind of talking about the weather delays and what we've had to put in place in order to mobilize this week. And so, as you all know, we closed our vaccine and testing closures last week. And we also, per Dr. Pickett's information, we were not able to provide any updates. One of the things that did happen over the time with the weather, there was where one of our locations where we keep our vaccine, the power went out, and we also have a backup generator. Well, the backup generator went out as well. All of our vaccines have an alarm system tied to them. And so we were alerted, worked with fire and EMS, and so they were able to assist us with moving the vaccine over to another one of our locations. That location did have power, but all of our sites as well, each of them have a backup generator. And so we were able to move our vaccine safely. We informed the state of Texas about us moving our vaccine, and we did not lose any vaccine. All of our vaccine was kept safe. And so I just wanted to alert you of that, and then just really give accolades to fire and EMS for helping us and my staff that came out to ensure they were able to get into the various buildings, et cetera, working together. What we've done for our weather mitigation plans, is we've opened up an additional site, we've extended some hours, and we've added some additional days. And so our goal is to complete 37,000 vaccines this week. That's going to include your first and your second dose. Next slide, please. This is a photograph of one of our patients that came in, got his permission to use his photo, and he's getting his second vaccine. We've been able to provide 56,000 vaccines have been distributed. Those are first, as well as some of the second doses that we began the week before the weather impacted service delivery. We continue to meet with our vaccine coalition. We meet with them monthly. And we're in discussions with the Department of State Health Services upon the pending approval of the Johnson & Johnson vaccine. Next slide. This is just kind of a snapshot of what we are sending out to folks for their second dose appointment. And so it provides the location, the date and time of where they need to go. They do not need to get on our system to schedule a second dose appointment. And so what we are encouraging folks is that if they have not heard from us, we're asking them to reach out to 311. 311 at this time is collecting that information, name, email, phone number, and they are providing us a daily report, and our staff are calling people back to make sure we are getting them scheduled. We have made some significant changes and upgrades to our technology. On Tuesday, we released appointments, and we have received positive feedback from that solution. We have updated and put a queuing element to it where it allows folks to queue, but it also allows you to know if you've selected Dove Springs or you've selected, one of the other sites. It lets you know how many, appointments we have left for that area. We're continuing to work on that area with our technology, but technology is moving along very well. Our three areas of, I'm going to say four, if we include 311 from the message perspective, our nurses are still taking calls, and we've set up our equity line, which is an outbound call for folks that don't have access to the internet and need to get in. And then Travis County is also assisting us as well. Next slide. This provides just a sample of vaccine notifications. They will either come to your desktop or you'll see the text message that folks will receive. We are proactively reaching out to folks just to let them know, it is almost time for your vaccine, or you are registered in our system. So we are proactively sending those messages out to folks. Next slide. One of the changes we were alerted on last week from the Texas Department of State Services that what they are going to do for us and across the state of Texas is that they are going to automatically start shipping out the doses for the second doses. So what this has done for us, we're really excited about it. So when people are coming in this week to get their first dose, they're receiving a card. And so our staff will go ahead and schedule them for 4 weeks out because we now know that Dishes is going to just send us that automatic shipment. So that is really great news for us. Even though we were proactively sending out second doses, this also kind of gives folks the assurance to know, I have my card, this is actually an appointment, and then they will receive a follow-up message from their computer and or text. I want to just remind folks that the second dose actually mirrors the first dose. So for the folks that we provided the first vaccine to, that second dose will come to us automatically. So unfortunately, we don't have extra doses to provide folks that did not come to us for their first allocation. The state is continuing to determine our allocations that are coming to us. One of the things that was shared with us is that typically the state of Texas is alerted on Monday about how much their allocation is going to be. Based upon what that allocation is, then they provide by Wednesday to each of the local health department and providers how much vaccine will come to them the following week. That is all the notification at the state level that they are receiving. And so we were in a meeting with the Centers for Disease Control, and they alerted us to what they are working on, and they have communicated that with the state. The state has said that that is not in place yet, but that is a goal that the federal government has, is that they're wanting to be able to provide at least 3 weeks worth of notification about what they will receive. When they are able to receive that at the state level from the federal level, they are going to pass that information on to the local level to the providers. Once we have that, we'll be able to set appointments 3 weeks out based upon that allocation. So that is something that's in the works. I talked to the state this morning. They still don't have an ETA on that. And so the federal government has decided to do that, but they've not implemented that as of yet. So I just wanted to let you know that those things are in the works, and we're really hopeful about that. Next slide. The other thing I'd like to share and actually acknowledge Travis County and City of Austin came together to put together this centraltextvax.org. It is a website where folks can go on to check with the vaccine hubs or other providers, and you're able to go in and look and see who has providers, and then it has the link that will take you over to that site. This is not a centralized way of how to get your vaccine, but it at least puts the providers that we are aware of. This is a regional effort, so it has 10 counties information in there, and so folks are at least able to get into the hub site or get into the other vaccine provider, and then the link takes them over to that provider to see if they have vaccine. But this was a way of just kind of having a one-stop shop for the information that we have. With more information, they're going to update this site and add more information. The last thing I want to share is that the federal pharmacy program is really up and running, getting very robust. We have been alerted that HEB, Walmart, Sam's, Walgreens, CVS, as you all know, CVS actually started providing vaccines on February 12th. And so each of those will start to receive direct shipments from the federal government for being a part of the pharmacy program. There are two other pharmacies in town that are part of a good pharmacy program, and so they also will be receiving vaccines from the federal government. I don't have an ETA of when that would happen, but we are hearing that with shipments that are coming in this week and next week, we're anticipating that there will be more vaccines available through those outlets. In addition, in conversations with Community Care was selected by the federal government as a federally qualified health center to be able to receive additional vaccines straight from the federal government as well. So as you can see, we are definitely going to start seeing more opportunity to get vaccines in our community. That completes my report, and I am available for questions. Thank you.
Thank you, Dr. Pickett and Director Hayden Howard. And with that, Mayor, I'll turn it back to you for questions from you and your colleagues. You're on mute.
You're muted.
Thank you. Let's go ahead and try to do what we were doing at the county before. Let's cycle through, ask a question, then we'll pass it on. We'll just keep going through council, and that way everybody gets a chance to be able to do that. All right. Does anybody want to start us off? Councilmember Fuentes, and then Councilmember Kelly.
Thank you, Mayor. Thank you, Director Hayden Howard. I really appreciate the update. And I just wanted to get a sense of, it's great news that we're going to be able to get out 31,000 vaccines this week. That's incredible. And it's exciting to see that level of progress, especially coming out of this storm. So I wanted to see if you could give us a sense, knowing that that's how much APH is going to be able to get out, knowing that we had additional pharmacies come online in the past few weeks and are now getting federal assistance in helping us get out vaccines to the community. What does the snapshot look like for the amount of seniors who are eligible per the 1B category, who are on our wait list, waiting to get a vaccine? How many do we have left? And just general thoughts on how quickly we can get through that wait list.
I think what I would have to do is I don't have that granular data in front of me. And so what we'll have to do is prepare that and send that back. I can ask the folks that put together the questions so we can send that back and it comes back to Mayor and Council. So we will definitely do that. As you know, we do continue to make sure we're focusing in on the different areas. One of the other things we have not been doing, and we're going to start having conversations with providers, like we did with testing, is ask them to provide the demographic data to us. We feel like that worked out well for us with testing, but we are going to have those conversations with them about providing their demographic data. So at least for Travis County, we're able to see it here. Now you are able to see it at the state level, but we want to make sure we have that type of data at the local level.
Well, and just to confirm, we do have APH does have demographic data online for our dashboard, right?
Yes.
So just real quick, even though we don't know quite how many seniors we have on our wait list, at least know how many vaccines are circulating throughout Austin with private providers and pharmacies and APH and community care. Like, how many vaccines do you anticipate the Austin area, Travis County area, to be able to get out this week?
I don't have any idea of what any of the partners are putting out this week. I do know that Judge Brown has an event on Saturday that they are working on with community care, and so that will be 3,000 vaccines that they are providing. But beyond that, I don't have an idea of how many vaccines are going out in Travis County this week.
Okay, thank you.
Okay, Councilor Kelly.
Thank you for that comprehensive update about the COVID-19 and vaccine process. I'd like to thank all of the staff who was at the Palmer Event Center as well, especially from Austin Public Health and our police officers who were there. I went and visited, and it was a great operation, and I appreciated the time that staff gave to me to show me around and talk to me about how it happened. I'd like to switch gears a little bit and talk about the COVID isolation facility in my district at the Candlewood. Could you please maybe talk about the pipe that burst over there and what happened with the people who are isolated there, and what plans are in the future for getting that fixed, and also how it might affect us opening up an additional isolation facility?
According to the information that I received, a pipe did burst in that building before the weather got very cold. Those individuals were transferred over to our isolation facility number 1. And so the goal is they were really trying to get that fixed within the 7 days, and then of course the weather happened. So I don't have an ETA of when that when they were going to be able to fix that bursted pipe. But my understanding is that we started looking for an additional site if we needed it as another asset, as a backup, if that pipe cannot be fixed. And so my understanding is that's what staff are working on now to determine, do we need to stand up another location temporarily until that work can be completed.
Thank you. I do have a couple follow-up questions, if that's okay. The first one is, how many beds do we currently have available at the Fairfield Isolation Facility? And the second one is the city responsible for the pipe damage? And if so, has anyone been out there? Are we still paying for use of that facility while it's being repaired?
I would have to talk with Juan Ortiz, the emergency, the Homeless Services Director, because he would have all of that information. I don't know if he's like waiting for the next iteration. He can provide that specific detail about both of those. But typically, as the owner, it's like owning a home. If you own it, you are responsible for the repairs. So if you live in a home and you're paying for where you live, you have to still continue to pay, for that facility. But they can definitely, Alex or someone else can definitely verify that. But we are going to be responsible to fix that facility.
Okay, thank you so much. If staff could follow back up with my office about that, it would be appreciated. And again, thank you so much for all that you're doing.
Thank you.
Councilmember Ellis.
Thank you, Mayor. And I really appreciate these briefings to keep us rolling since we are dealing with a number of crises at the same time. Can you tell me for today's appointments, the website right now says that appointments should be coming online to be scheduled today, but I'm getting word that people are refreshing and it just keeps saying the date and it doesn't actually open up the appointments. Do you know what's going on with those?
Yeah, they've not released those yet. They are going to be released later on. Typically with the system that we do have in place, on Thursday, it does allow people to be able to queue. So it will happen later on today. We're just making sure, we have everything we need, accounting for the location on yesterday. We provided about 5,500 vaccines on yesterday. So typically it is making sure that you have enough vaccines for the remainder of the week. And that's how you open it up the next day. So today is based upon what we've done over the last couple of days. So they are working on that.
Okay, so is there any more specific time expectation at this point? Okay.
No, ma'am.
Okay, thank you. And I have heard anecdotally that the second round of vaccines is working really smoothly. And so I wanted to pass along the compliments that people have sent to us, that they really appreciate how well that's working. Can you tell me a little more information, since obviously there were a lot of people due for their second vaccination over the past week, how that triage is going to kind of catch up with how quickly people need to get that second vaccine, and now that there may be kind of a backlog, how that's going to work moving forward, just so people have an expectation.
So for the people that are in Salesforce proper, they're able to run a query and they're able to tell exactly kind of where they are with their vaccine. And so based upon the ones, that are beyond, 28 days, and definitely trying to get them before 42 days, they are reaching out to them proactively, sending them an email, etc. We do know that there still were a few folks that showed up to the site. We put them in Imatrack, so our staff are working on them as well. So if you have folks that may have been with the people that we provided a courtesy vaccine to on the 11th, 12th, or 13th of January, tell them to go ahead and call 311 and we'll get that information, and then we will call them and schedule them to come in, because we do know that there are a few people that came and didn't have appointments. But typically our system is able to queue those, flag those to our folks, and then they're proactively sending out emails. There are some individuals that our staff in Travis County has been calling by phone this week, and so we're doing both of those as well.
Okay, that's great to hear. I know there's a lot going on and a lot of vaccines being distributed, and so there were some concerns I had heard where people just said, well, what does that mean for my second round vaccination? So it's good to hear you're being proactive about outreach and trying to catch up on those. I did hear about the Circuit of America's kind of mass vaccination site. Is that a county initiative, and are you working with them on that, or are those parallel operations that you're running right now?
That is a county and community care as well as Seton initiative. And so as you may have read, there were several county judges that made the request to the Department of State Health Services, and they granted them 3,000 vaccines. And so basically seeing how that works across all of those counties this weekend. And so if it does look promising, the state is willing to provide more vaccine. So that's going to be a great pilot for our community, and not just for Travis County, but for all of those other counties that may have not even potentially have received any vaccines.
Okay, and so looking into that would be a different website. That wouldn't be through the austintexas.gov. That would be through a different website. Is that one that you could share just for people taking note?
Yes, we'll ask, because typically what's happening is because it's community care patients, and they're working with those counties off of their wait list as well. So if folks are in the neighboring counties, they need to check those websites. And if they're in the Austin website, in the Austin, Travis County area, then they need to look on the Community Cares website. Now, it's not a open process. They are using, for community care in Travis County, they're using their existing patients for that right now.
Okay, that's really helpful. Thank you so much, and thanks for your hard work.
Councilmember Kitchen. Councilmember Kitchen, and then the Mayor Pro Tem.
Thank you very much. I really appreciate the improvements that are being made to the website. It's been very helpful for people, and I too want to pass along the feedback I'm getting particularly about the second doses and how well that is working for people. So I want to say thank you for that. I wanted to ask a few more questions. I also want to say thank you because I know that folks are reaching out by telephone to our seniors and helping them schedule. And so it's been very helpful for our seniors, particularly those who don't have access to an internet or an email, to be able to receive a phone call. And that's been particularly helpful for our elderly folks in the community. So I want to say thank you for that. I do want to just highlight. I would like you to just explain again for folks what's happening there. So just for awareness, and also to let you know that through our senior welfare checks initiative that I'll talk more about later, that we just all helped reach out to seniors with a disaster response to help them with water and food and other things. We also did end up identifying some folks who are asking us about vaccines. So this is just, we will be sending you over a list of those individuals. And our response to them was that we would pass their names on. So, and these are seniors over age, well, I think they're over age 70 in the community, and a number of them are quite a bit older. So that list is being finalized, and we'll get that sent over to you. So could you take just a moment and let people know more about what you all are doing with reaching out to seniors?
Yes, so there's kind of several things that are happening. Some of it is based upon the information that we have in our Salesforce platform. Some of it is based upon referrals that we've received from our partners that work with the elderly population. And so as a result of those referrals, we're able to proactively reach out to folks and get them scheduled. And so what we are finding is that some folks may also require transportation. So working with them to get the transportation to them as well, because they want to go ahead and come in. As you all know, we have stood up our mobile operations. And so this week we are working through the housing authority that was actually scheduled for last week, but we shifted it back to this week. And so the seniors that we've been contacting, if they have the transportation, they're like, no. So we're just working with them to go ahead and bring them in via transportation. But that process is definitely working well, and our goal is to make sure we get through as many seniors as we can.
Well, thank you very much. I know the feedback I've gotten is that people are very, very, very appreciative of y'all's efforts. So thank you.
Thank you, Mayor Pro Tem. And then I think Councilmember Alter had her hand raised, and then Councilmember Tobin.
Thank you, Mayor. I appreciate it. I think my colleagues will probably cover most of the questions that I have. In fact, some things have already been covered. One thing that I wanted to ask, and I don't know if this is a Director Hayden Howard question or a Dr. Pickett question. That graph where you showed the spike for the 20 to 29-year-olds, I'm just curious about whether or not you have any indication what are the implications there? What behaviors do we need to be mindful of? Like, what's happening to shift that age group?
Thank you. That's a very good question. And I think that some of that is that we're seeing not a lot of movement in that age group, whereas the overall cases are declining. So it may be, as you look from 1 week to the next, there was not a huge shift in the number of patients within that age group, that 20 to 29 age group, whereas there were decreases in others. So it does look like a bit of a spike. I'm not sure, though, that it necessarily represents a big shift. Just from 1 week to another, it represented a shift of only a couple of patients total.
A couple literally?
Yes, ma'am.
Oh, okay, thank you. So there's not some massive concern that we need to be making sure to communicate to the community about that age group and anything that people need to be avoiding or?
Well, of course, we always want to continue to communicate the distancing and masking and so forth. That age group had sometimes proved challenging with those messages and adherence to those guidelines, but that we want to continue to reinforce those messages that we've brought out previously.
Thank you. I appreciate that. And then the other question that I have, or actually it's not a question so much as I'd like to present an opportunity that was shared with my office. Apparently the Trail of Lights Foundation has partnered with APH to support the COVID-19 vaccination operation, hiring people. Most positions are not clinical, $20 per hour, start immediately. Director Hayden Howard, I wonder if you can speak to that in a way that's more comprehensive than what I'm able to just by way of this quick message that was sent to me.
Yes. What we've done is working with that foundation to assist us with parking lot outside management. As you all know, one of the huge concerns that we had is when it was really cold outside, we could not get people to remain in their cars. So with all of our systems we continue to set up, they didn't want to stay in there. So what we thought is that let's work with a professional that's done this in so many other ways and has done it well. And so basically, they're going to be working with people as they're coming into the parking lot, making sure any questions that they have appointments, checking their appointments, etc. So everything kind of around the perimeter, parking lot, et cetera, they are going to be addressing that at our large locations. So right now we're at Delco and we are at the Performance Arts Center. And so they are assisting us in those locations. And so what we were able to do is that our staff that were out there, we were able to reassign and shift them, and we're able to open up another location.
Thank you. I appreciate that. Is there a place where people can go to get that link to sign up to get those opportunities? Something that we recognized at the Millennium at Sims, generally in Central East Austin. I don't know if they were available to y'all across the city, but when I say that the musicians and the advocacy organizations that represent musicians, there's 4 of them, and I know I'm going to forget a name, so I won't say the names. Y'all know who you are. They showed up. We consistently had over 100 volunteers from those organizations over the course of the last several days. That to say, a lot of those folks have been out of work. And so them having the opportunity to actually be gainfully employed and address crisis would be fantastic. I just want to make sure that they know how to find that information.
Okay, we will make sure to send that out so all of you will have it.
Just real quick, just to be clear, is there a way for us to put it on a public facing, maybe on APH site, or is there a place that we could just direct them?
Let me get with the communications folks and let them kind of figure that out. I try to stay in my lane.
I understand. Thank you. That's fair. I appreciate it. And I'll just echo what my colleagues have already said about the magnificent job that our Austin Public Health Department has done. Thank you so much. We appreciate y'all. And just generally, our staff has been showing up. If there's any confusion about how much appreciation we have for our staff, let me just clear that up now. We appreciate you all so very much. I also look forward to some of these continued conversations. I look forward to us talking about how we can help to fortify our public health department now that we all recognize that it is of the utmost importance. So thank you again, Director Hayden Howard. We appreciate you.
Thank you.
Mayor Pro Tem, it's a good point to get those volunteers out, and there is a specific link to do that, so we need to get that out for more people to sign up to volunteer. Colleagues, it is a little after 11. We're going to continue through the folks that haven't had a chance to get called yet on the COVID deal, but I urge everybody to move quickly because at 12:30, I think the desires manager was to get some of the disaster people back out into the field. They're with us, so we still need the presentations from the disaster people and then the folks to be able to ask them questions. So to the degree you can follow up with questions about COVID, we probably want to take advantage of that. So Councilmember Ellis, you're raising your hand, but you've already had a turn. Are you real quick?
Yes, I have the link. I wanted to spell it out while we were all on the topic. It is vxatx.com.
Say it again, please.
vxatx.com.
Axtext.com. Thank you.
VX. Yep.
Okay, Councilmember Alter, then Councilmember Tova.
Thank you. So I'm actually still hearing that the system is still complicated for seniors who are trying to sign up and requiring folks to have somebody who's helping them to sign them up. So I'm this has been expressed multiple times about concern about folks who are not tech savvy. And it seems like it's still exceedingly difficult. I'm really pleased that we're able to change our process for second doses and just give appointments right away. But I need you to clarify how that appointment process is working for seniors at this point, because from what I heard from last night, it hadn't changed much. Folks who were 80 plus did not get emails. Folks who were alerted that the system opened because they had somebody who was tech savvy and was on a Facebook group were able to get in and get their appointments. And so I need some more clarification. And I know that some throughout this, but if I was a senior who was going through this process and I tried to go in there, how is that working at this point? If I'm signing up for the first time, or if I'm still trying to get my second dose, and and I wasn't in the batch that was lucky enough to get an appointment for my second dose when I did my first.
So with the second dose, we don't want anyone to go in the system. There's no need for you to go in the system. Staff will send you out. If you register through Salesforce and kind of went through that process, then we will reach out to you. And so they just need to wait until folks reach out to them. If you have some folks that did not go through that process and we called and scheduled, etc., we're still calling them as well. I think the thing to keep in mind is that we had to go back to February 12th because we didn't have a clinic that day. So we need to pick up everybody from February 12th, but we also need to pick up anybody from during that week that were a no-show and reach back out to them. And so we needed to plug in that week and last week to make sure we're getting them in this week. And so it may be a matter of we've not gotten to them because based upon our system, we want to make sure the people that have been waiting longer for the second dose, we've contacted them. So that's one piece, but tell folks, don't go back in the system. I think the other thing is that if you have folks that are that age, just tell them to call 311. We've established a process with them, and they can say, you know, I was trying to register, or I'm trying to register, or whatever that the case may be. They're creating service requests, and they are sending every day, they're sending a batch over to our folks, and our folks are calling them. And so in addition to that, we also have folks that are reaching out proactively based upon who we're seeing in Salesforce. So we have a lot of kind of things going on from a call center perspective. And so I think probably the easiest thing you can tell your seniors is just to call 311 and we'll work it, you know, from there. So even if they're concerned about the second dose, et cetera, that would probably be an easier solution. And then that information comes to us and then we call them back.
Okay, so we should be recommending to the seniors who are having trouble navigating the system to get an appointment that they can just call 311 and then they can call 311 and then they will be called as a follow-up from someone there. Now, one of the things we're seeing though is a lot of, you know, relatives are trying to take this on for them. Can they also call 311 and do that on behalf of somebody, as long as the person who would be showing up would be the person who's eligible? Because not every senior is able to navigate those phone calls and write it down and make all those arrangements on their own.
Yes, I mean, you know, typically, you know, and this is kind of the typical process for really any kind of social service agency. They're going to want to speak to the person because that is the client, but they're going to say, give me permission to talk to your daughter, give me permission to talk to your son or whoever's calling for you. You're going to ask that of the person first to get that permission, and then they can work with that person to get them scheduled. So that is.
Okay, so will 311 take both of those numbers in? They have a mechanism to do that when they get the information in the first place?
They're going to take the information that the caller provides. So if they give their name, their phone number, and what they need, then they're going to take that information in. Based upon that and the information they provide 311, then they're going to send it over to our staff. So even if our staff call and they get that person, then, you know, they can tell us, well, my daughter is taking care of this. Can you call them? That will not be a problem for our staff to do that. So just, I think the easiest thing is just have them call 311 and we'll definitely take it from there.
Okay, thank you. And can we get some of this in our write-up so that we can share it as clearly as possible with folks what the messaging is on this when you get a chance over the next couple of days? Thank you.
Okay, colleagues, anything else before we go to, Councilmember Tovo, sorry.
That's okay. Thank you. I didn't want the moment to go by, Director Hayden, without just really underscoring huge thanks to your staff who in the middle of this emergency went and got those vaccinations, those vaccination dosages. That's really extraordinary. Also, I just have some quick questions. As I understand our conversation here today, for those who have not received information about a second dose, they are, and the time has been a while, they can reach out to 311, APH will call them. In addition to the ability, as you said, of going through Salesforce and seeing where they are in the process.
Yes.
Are individuals able at this point to check the same system to see if they have successfully registered? Does the system now allow them to do that?
Yes, it does allow them. They should have received, when they completed their registration, they should have received a message that said you've completed your registration. Also, they should have received some subsequent message to say, we still have your registration, you're registered with us or whatever. We're doing those proactive reach outs as well. So
Okay.
if they're not receiving that, then we would want them to call 311 because they'll do a service record for them, a service request for them and send it to us.
Thank you. And that is for individuals who are both eligible at this stage and ineligible. Back a few weeks ago, there could be 3 reasons why somebody hadn't heard, one of which was that they are not eligible yet. But even if they're ineligible and they've registered, they should still receive that confirmation back from the system saying, we received your registration.
Yes, yes.
Okay. Thanks for that clarification. So in the conversation earlier with Councilmember Ellis, you indicated that more vaccines would be released today. We've received a few constituents who wrote and said that they actually today tried and received a message back saying that that APH would not be releasing any more vaccination until 3/1. So I just want to make sure I'm clear on whether there would be vaccine released today, or whether the message that some people have received is the accurate one.
Well, as far as I know, when I talked with my staff, they told me we were releasing appointments this morning. So I will tell you, even though we've done significant work on that system, there's still a few more things that we are finding. So I'm just kind of taking notes, and I'm going to let my IT folks know about sounds like it's an error message is what that is to me.
I can also forward that on to the appropriate staff member so that you can see exactly what they described. I have another one like that. I think it's in the vein of a suggestion. The new system, I think this happened after the new system because it happened a few days ago. We got an email from a constituent who said they made it through the process and it said your appointment's not confirmed until you proceed to the next page. When they got to the next page, it rolled and rolled and rolled, and then kind of kicked them back or said no appointments are available. So there for some users, it looks as if appointments are available, but then as they try to progress along the next stage, they're told it's not. So if that's a consistent experience people are having, I wonder if there's a way to indicate at the beginning of that process there are no appointments available right now, rather than kind of taking them through the various steps. I'll forward you that email as well. Or if there's somebody else on your staff, I know you've got lots of email coming in.
You can send it to me. I'll
Okay.
get it to our IT folks.
I
So,
appreciate
thank
it.
you.
Thanks
Thank
again
you.
for the tremendous
Okay.
work under extraordinary circumstances.
Thank you. Colleagues, anything else on this part of the presentation before we get into the disaster? Just real fast, 31,000 out this week is an incredible number, and I hope that you continue to get the supply to be able to do that, not just because we have the supplies from last week and this week, but actually start increasing the numbers because we have the capacity to get it out. I appreciate the effort, Judge Brown, in working with the other 3 counties in the area to increase our supply of vaccine. My understanding from talking to Judge Brown is that will be additive to the numbers that Austin Public Health is getting, and I appreciate the focus on community care folks, as well as the community care clients in each of those other 3 areas and the like. you're opening up more sites in order to be able to deliver this capacity over time. And as you open those, you'll be letting the public know, but just to let everybody know that you are planning for those plans and developing additional sites. Isn't that right, Dr. Hayden? Additional sites coming on. I don't know if you've gotten to a place where you're announcing any of those yet, or you're going to wait until you're just about to open them?
We did announce that the Performing Arts Center is the additional area that we added this week. And actually, we added that location, to be able to give us that additional capacity, but we will remain there for a while to be able to provide those vaccines there.
And we have additional places we can go to if the state and the federal government will give us additional supply to get out. Thank you for the tech advancements. I think the queuing capacity and just getting back to people with those weekly notes to say, hey, we remember who you are and you're in our system. Don't worry, it'll be really helpful, because just hearing something, I think, is going to be really helpful and letting people know where they are. I know you said you were trying to get the demographic data out of the other supplier, the other people that are providing vaccines. And I think someone asked the question, you've given out 50 some odd thousand at Austin Public Health. The question was, how much have we given in the area? And I think the number that I had seen was somewhere just over 100,000 if you consider everybody. But it's really tough to have visibility to that because they don't have to report to us. And that was before we had this last push. But if you need me to enter the same kind of order that I entered when we were doing testing, that orders all those folks to give over the demographic data, even though they're giving it to the state, please let me know so that I can work with legal to get that out. There was a graph in the New York Times today talking about the drop in nursing home deaths, pretty dramatic. And they think it's because they're now vaccinating people that are in nursing home in that age. If you could take a look at that, I'd be interested in maybe a follow-up note to the council with respect to, it looks like our numbers are down at the higher ages. The oldest age group seems to have the most dramatic drop in hospitalizations, but if you could confirm that, I'd appreciate that. Next steps, I think that people are talking about maybe looking at the alternate care facility. I just want people to know that next step is there. We get questions about moving to the yellow risk level 3, and that would have us dropping below 30. We're kind of locked in the middle in the 30 range here, so we're close to that. My hope is that the community will get us below that 30 so we can own it. Sufficient for Director Hayden and Dr. Escott to recommend that we actually move there. And then finally, I am also getting great reports about the processing at the vaccination sites. People seem to be moving through very, very quickly, and that positive data is coming in. All right, Manager, if you could then, thank you, Director Hayden, thank you, Dr. Pickett. We don't often get to see you, but you are among the people that have not slept in months. So it's good for the council to be able to see you too. Please thank both of you, your staffs, which are some year they'll get the opportunity to rest again. Manager, if you'll take us through the disaster presentation.
Thank you, Mayor and Council, and thank you again, Dr. Pickett, Dr. Hayden Howard.